empathy is. Why is empathy important to paramedicine? Well, the level of empathy a paramedic shows towards a patient can have a significant impact on the outcome of their treatment. Evidence suggests that empathy builds trust between the patient and healthcare provider, which increases treatment compliance and decreases medical errors and lapses in professional behavior. And now Kate is going to further elaborate on the research we found surrounding empathy and paramedicine. Kate?
Thank you, Jenalyn. So for our review of the literature, we were actually able to find quite a bit of information about empathy in healthcare in general. So we were able to find information about the benefits of empathy in healthcare, about ways that we measure it, ways that we teach it, as well as specific empathy levels in many different students in different healthcare professions. So there's a few main points from that literature, which I'll share with you quickly. One of the main, most interesting things we found was that paramedic students, compared to other healthcare profession students, such as nursing, midwifery, double degree nursing paramedic, medicine, occupational therapy, nutrition and dietary students, as well as physiotherapy students, paramedics had the lowest empathy levels out of all of those, with the exception of the double degree nursing paramedic students. In addition, when paramedic students were actually compared to people in actual healthcare professions, so these are people such as nurses, pediatricians, hospital-based physicians, and final year medical students, they were also found to have lower levels of empathy. Some other trends these studies found were that age, gender, and the year of the student's study did have an effect on their empathy levels. So some of the common conclusions were that females tended to have higher empathy levels than males. Older students tended to have higher empathy than younger students. And then there was some discrepancies in the research as to whether or not your empathy levels decreased or increased with your year of study. Some said you got more empathetic, and other studies show you got less empathetic. The lack of consistency among some of this research is likely because while we found a lot of information on healthcare in general, the actual information specific to paramedicine is not that great. There's one study done here at the college last year on empathy in paramedic students, and there's a couple others done by an institute in Australia, as many other paramedic research is done down in Australia, but because there's not a huge amount, the external validity of these results is not that strong. So, we decided to continue that research, and the research study or question that we chose to explore was, is there an actual change in first year paramedic students' perceived empathy and self-reported empathy levels throughout their first year? To do this, we chose to use the medical condition regard scale, which is commonly used in a couple other studies. It's a survey that measures empathy, and the four conditions we were measuring empathy against were acute mental illness, attempted suicide, substance abuse, and intellectual disabilities. And I'll give it back to Jenna.
Great, thank you, Kate. And next, Chris is going to explain how we conducted our research and the medical condition regard scale. Chris?
The surveys were administered in person during our first year paramedic class at the college. The three occasions that we administered the surveys were in first semester prior to any placement, at the beginning of second semester, and at near the end of second semester when they had some more experience on placement. The surveys were explained to the students, and they were provided an information sheet about the survey. Prior to completing the surveys, they were reminded that it was voluntary and that their results would be kept confidential. Once the surveys were completed, a code was assigned to each student and placed on their surveys, and the consent form with their name on it was removed. The code included age and gender to allow our data analysis team to analyze for those variables, and there was also a spot to indicate if the student had prior post-secondary education. So just to see the MCRS, this is an example of it here. It is an 11-item survey that uses a 6-point Likert scale that allows you to either strongly disagree to strongly agree with each statement provided. It's regarded as a reliable tool that can be used to evaluate emotions and biases related to any medical condition. So a few examples of statements are, I prefer not to work with patients like this. Patients like this irritate me, and I can usually find something that helps patients like this feel better.
Thank you, Chris. And now we have Lisa and Wes to explain our data analysis. Wes?
So to describe a little bit about our patients, as you can see on our graph, we did 3 different types of surveys, and different amounts of participants responded in each time period. So in total we had 44 participants that did respond. However, we did have to disqualify many participants for not completing the surveys in all 3 time periods. So in the end of the completion of our analysis, we had 11 females so it's a 25% response rate, and 9 males with a 20.4% response rate that remained in our survey. As I explained earlier, our hypothesis was that empathy levels will decrease as students progress through the first year in the paramedic program. In order to organize and analyze this data, we utilize Microsoft Excel for purely familiarity. Because of our low numbers of data, or low numbers of participants, we do not have statistically significant data. And therefore, we are unable to statistically prove or disprove our hypothesis. However, we are able to show trends to prove our hypothesis. Like Chris was saying, we used the MCRS for descriptive statistics and looked for the mean and demographic data. We made comparisons with age, gender, and also previous education. And for the MCRS, like Chris was also explaining, that we have strongly agree, is rated as a 1, and strongly agree, and rated as a 6. So the lowest possible score anybody can receive for a specific condition is 11 and 66 respectively. Higher scores obviously mean higher regard towards empathy. Now Lisa's going to further explain a little bit of our results. Lisa?
Yes. Okay, so the next few slides we have here are some visual representations of our data. So figure 1 here shows the average empathy scores related to gender. So on the y-axis, we have our average empathy scores, and we know that this ranges from 11 to 66. On the x-axis, we have the 4 conditions that the MCRS evaluated. So we have substance abuse, attempted suicide, acute mental illness, and intellectual disabilities. In blue, we have the females represented. This included 11 participants. In gray, we represent the males, and this included 9 participants. As you can see, the females did score higher in all 4 categories. Figure 2 represents the average empathy scores related to 3 different age categories. So in blue, we have the 19 to 21-year-olds, and this represented 8 participants. In gray, we have the 22 to 24 years, and this represented 7 participants. And those 25 years and older are represented in orange, and this included 5 participants. As you can see again, those 22 to 24 years scored the highest average empathy scores in all 4 categories. Figure 3 here shows the average empathy scores related to post-secondary education. So in blue, we have those with previous post-secondary education, and in orange, we have those with no previous post-secondary education. Again, so previous post-secondary education, the population was 7, and with no previous post-secondary education, the sample size was 13. And again, as you can see, those with previous post-secondary education scored the highest empathy levels in all 4 categories. So shout out to the females 22 to 24 years with previous post-secondary education. So our last graph here is the longitudinal aspect of our research. So figure 4 shows the overall average empathy score over the duration of our study for the 4 conditions evaluated by the MCRS. So on the y-axis, or the point on the y-axis there represents the first survey, the middle point represents the second survey, and then the last point
represents the third survey. The lines are just there to help us see the trends. In blue, we have substance abuse, yellow, attempted suicide, green, acute mental illness, and red, intellectual disabilities. So some important things to note is the average empathy scores towards those patients, the substance abuse patients was significantly lower than all the other three categories. Empathy levels towards intellectual disabilities and attempted suicide steadily decreased over the duration of the study. And finally, the levels for acute mental illness stayed relatively consistent over the duration of the study. Thank you, Lisa and Wes. And finally, Alberto will outline the implications of our research and future considerations. Alberto?
Thank you, Jenna. So first and foremost, the implication of our research was to increase the breadth of knowledge on the topic of empathy within paramedic and other healthcare students. Currently, as stated before by Kate, the majority of the research on the profession of paramedicine, and more specifically on the topic of empathy, is mainly done and conducted in Australia. So one of the goals of our study was to take a population of Canadian paramedic students and compare them to compare their empathy levels to the empathy levels of Australian students, just to see if Canadian students follow the same trend and have lower empathy scores than other healthcare students. Secondary to evaluating the empathy levels, we wanted to try and shed some light on whether or not the Canadian paramedic programs needed an increase in training on empathy or some sort of increase of education. As previously mentioned, showing empathy or having empathetic patient care can be really beneficial to the patient as well as the healthcare provider. Previous studies and research has shown that improved empathy during patient care can increase the patient satisfaction as well as compliance, and can also benefit the overall experience of the patient and the healthcare provider both together. Lastly, we hope that our research, in addition to future research, could kind of identify or determine whether there was a specific reason as to why paramedics or paramedic students have lower levels of empathy scores than other healthcare students or other healthcare professionals. However, we wanted to kind of add to this and to determine whether or not if additional training on empathy and increasing that empathetic patient care could lead to an increase of risk for possible development of things like PTSD or other mental illness issues. So some of the suggestions we have for future research, one of the first ones we think would be very beneficial would be to follow students, second-year students specifically, and measure their empathy levels before and after the consolidation period. So for those of you who don't know, this is our 4th semester when we're on ride-outs, basically working full-time, and it involves the majority of our experience with patients. Measuring our levels before and after this period could really shine some light on whether or not this massive increase and quick increase of exposure to real-life patients has an effect on empathy levels in paramedic students. Second, tying along with the first one, would just be to perform a longer study design. This could involve measuring empathy levels as soon as students start the program to graduation, and even further following them into when they start their careers. This could possibly show whether empathy levels decrease or increase or have no change during school, and more so change during actual on-the-job experience, or whether it's really in school that these empathy levels are changing. And lastly would be to study the empathy levels between new and experienced paramedics, just to get a sense for if years of experience dealing with patients has an effect on the empathy levels.
Thank you, Alberto. While increasing a paramedic's level of empathy may be better for patient care, we do acknowledge that there are risks every time we put ourselves in our patient's shoes. It is hard to say whether more empathetic paramedics will have an easier or harder time dealing with the hardships of this career. That is why getting involved in research is a great way to contribute to the community of paramedicine so that we can implement training that will benefit both our patients and ourselves. Thank you all for listening, and we're going to open up the floor for some questions.
Hello, Michael Brock, Middlesex London Paramedic Service precepting student. I found it very interesting that substance abuse kind of correlated with a much lower level of empathy. Did you guys find anything in similar studies or the literature that found that as well and gave any explanation for that? Or if not, like, do you guys have any personal opinions on why that might have happened?
Yeah, so the Australian survey and the survey that was done last year by Koos et al., those surveys did show the substance abuse was far lower as well. As to why, everyone to each their own opinion. Yeah, all through we've noticed that substance abuse does remain quite significantly lower.
Thank you.
Just on your last point, Jenalyn, what you were talking about, empathy and being vulnerable, does that predispose paramedics to PTSD, etc.? You did a lot of research on other fields. Did you find anything when you were in your literature review that would suggest otherwise, that maybe having a more personal connection with your patients would almost be protective of that?
Thank you, Megan. So for our literature review, the data does show that for patient care is kind of the outcome they measured. Being more empathetic was beneficial for patient care. It didn't actually study the effects on paramedics' emotions or the healthcare professional emotions after patient care was concluded and down the road. So that's why we think while empathy is really important to research and to talk about and to be empathetic, that's what we mentioned at the end. We think it's also really important to think about implementing strategies to help us deal with it if we need to be more empathetic, because it does put us at risk.
Great presentation. Just getting back to actually that same chart with the levels of empathy and how substance abuse was at the bottom, is that right? Yeah. I was thinking that maybe one of the reasons that it has one of the lowest levels of empathy is because it's not really seen as being tied to those other issues that are listed as dependent variables, like mental health. And so I think it's also really important to consider how those variables affect one another and how they're very much dependent on each other.
Great job, guys. Jeremy from Middlesex, London. Regarding your how you categorize the age ranges, I was wondering how you categorized it based on age. Was the deciding factor for those age ranges? And if you graphed it out differently, for example, like 25 plus, if you categorize maybe 22, 25, and then 27 plus, did you guys graph it out differently, and were there any differences regarding that?
So originally I went with 2 age categories, 25 plus and then 25 and under. The differing sample sizes, there were only 5 students that are older than 25, so we just broke it up into 3 to try and represent something more valid and consistent in the sample sizes. Does that answer your question?
Thank you.